Hello, viewers. Welcome to India's first ever healthcare podcast, National Health Diary. We are here to educate, advocate, and ensure no health concern goes unnoticed. Our vision is simple yet profound that society of proactive health choices are norm. We are here today with the first episode, and we want to address the issue of cancer of the society, which is smoking. We have Dr. Mallikarjun, who is a specialist of smoking cessation and also a pulmonologist who deals with the lung diseases. We'll discuss that every 6 seconds a person is dying from a disease related to smoking. If current trend continues, by end of 22nd century, smoking would have taken 1 billion lives. Is vape and hookah is as harmful as it sounds? And why people starts at first place? Here with us, Dr. Mallikarjun. Welcome, sir.
Thank you, Ashutosh, for the kind introduction and making me a part of first health podcast.
Dr. Mallikarjun is one of the top pulmonologists, leading pulmonologist of Bangalore, and he is working at HCG, which is a cancer hospital, and he sees in and out every day a lot of cancer patients. He also runs his clinic at JP Nagar, Haridan Clinic. So, Dr. Mallikarjun, I would like to ask the first question: what is tobacco?
Tobacco is basically a plant. The part of plant leaf is used in various forms
Okay.
for recreational activities. Before they used to use as some sacred part of some people. So basically it is used mainly for recreational activities.
What are the different forms of tobacco which has been used in, today's generation?
There are basically we can divide into two components. One is smokeless, another is smoke form. In smoke form, we can everyone knows cigarette. In that there are many types, BD, and to coming to the latest e-cigarettes, vaping, hookahs, different forms. They use it attributing to different events.
Okay.
And in smokeless form, chewing, tobacco chewing has been used. There are different names if you go to different parts of the country. Okay, they keep in the mouth at the side and they chew it. That is the most common smokeless form used.
I've seen some people smoke through the nose also. Is that also some part of
Yes,
nicotine?
yes. That is also there's paste is snuffed through the nose.
Okay.
The paste is snuffed through the nose.
And under the tongue as well.
Yeah, there is another form of smoking. Usually, the smoke straight, lit it and smoke it. Some people take it reverse smoking. They do as part of entertainment.
Okay, my next question is, what happens? What happens to our health? What happens inside our body when somebody is smoking or taking any form of tobacco?
Everyone knows because in this current technological world, there is a lot of information available if you just type on Google what it causes.
Right.
So I would like to define in one word, it can cause everything from your head till your toe. It can starting from your head, brain stroke can happen. Then if you come to the oral cavity and all bad odor or foul odor, then many cancers, head and neck cancers, cancer of your voice box, then coming down to the lungs cancer, chronic bronchitis, emphysema. We broadly categorize and call it as COPD, and their heart attacks, heart diseases, hypertension, that is raise of your blood pressure, diabetes. Then if you come down, cancer of the food pipe, cancer of the pancreas, cancer of the urinary bladder, varicose veins, so gangrene, so many things. Most of the diseases or whatever are there. Tobacco is a very important risk factor in it.
Okay. So you are seeing a lot of patients of cancer day in, day out coming with the respiratory problems. So how many percentage of patients you see with the history of smoking?
90%.
Okay.
It's 90% of the people who smoke, who are having lung cancer are smokers.
Okay.
Cancer also happen in non-smokers. So they ask Even if you smoke or not smoke, you will get. But the percentage, what it is, 90% of the cancer patients are smokers.
Okay. So only 10% patients, those who don't smoke, get cancer.
Cancer that may be due to many reasons, can be hereditary,
Right.
other things, exactly.
Or passive smoking.
That comes under smoking.
Okay.
So you have got in a good question. Passive smoking. So one is the direct smoking form,
Right.
which the person who is doing directly smokes, and when he smokes, the cigarette butt is burning,
Right.
and it is emitting a smoke. So that smoke who are surrounding is, it is as and equally dangerous the person who smokes.
Okay.
Okay, so that is one. One more is that is known as second hand smoke or environmental tobacco smoke. One more form is third hand smoke, we call, where the particles of the smoke after the cigarette and the on hand gets attached to the your surrounding environment, like your table, cloths. So that is another part of smoke.
So that is called as third hand smoking.
Yes.
I think this is something, a new fact which I'm learning about today. So the particles of the smoke stays on the shirt or
On
the
your
area
hand,
where we are
when you
smoking.
smoke, a lot of ash comes off out of it, which
Right.
is lying in the your room. Some people smoke in the room, so
Right.
those are part of the third hand smoke.
Okay, when the smoking is over, still somebody is entering in the room, they are having the risk of smoking.
Yes, those particles.
My next question is, why these days we see a lot of youngsters start smoking, like maybe they are following some movies, series, or they feel that okay, it is a energy booster. What do you want to say about this?
Definitely, it's not an energy booster.
Okay.
It decreases your energy levels. They falling prey because most of them associate some of their idols who are doing it. They see it as a fashion. They see it as a style without understanding its harmful effects. That is the main reason how they fall into prey. So the first and foremost thing is never get into the smoking addiction or habit.
Okay.
So that is the best form of treatment. Prevention is the best form of treatment.
Right. And even if somebody wants to quit, why why they are not able to prepare their mindset, and they find it very difficult to quit.
Okay. So yes, but it is very difficult to quit once they are fully addicted.
Okay.
If they are in the initial stages, it is easy to quit and make them understand. And one who are at the end of their life, like they are having problems due to smoking, there will be three category of people who are smokers. One is starting youngsters. They enjoy it for their entertainment or style, or being a part of party. Oh, if I don't smoke, I am isolated from the group. So that's how they become addicted, getting into the habit, initial act. So they don't have any harmful effects, so they are never bothered about quitting. Why should quit? If you are having any problem or any difficulties due to something, then only you will be planning
Right.
to quit it or take action against that. So initial part, it's all enjoyment, entertainment. So they will be going with the business as usual. And once in their midlife, or say in the 40s, 45s, then start having one by one problem, like your performance decreases, you will not be active so much, you will start having hypertension, you will start having diabetes, and you will start having some people before that they can have multiple health issues, stroke or heart attack. Many young patients we see. So those people understand, oh, my smoking is causing me problems, I have to quit it. They are more likely to listen, and they come themselves for quitting too. And the other end, last end, so those people, मेरा life हो गया, सब
Last
कुछ
stage.
जी लिया मैंने, king life king size जी लिया, nothing to do. I have a cancer already, I have a diabetes, my kids are there, grandkids are there, I'm enjoying, I want. But that is not. Even those who have cancer one, if they quit, it is shown that their cancer treatment goes better,
Okay.
the chance of having second cancer decreases.
Okay.
So there are many advantages of quitting at the end of life also. When you have even cancer, we have seen many second cancers. Like patient will be having head and neck cancer, they will develop lung cancer in 1 or 2 years subsequent.
So first cancer is treated, and if they stop smoking following by that, they can reduce the chances of the second cancer.
Second cancer, and the current cancer treatment is also better. So I would, with this explanation, I think I have answered your why it is difficult to
Right.
quit. So these are the scenarios I can think of, and we usually encounter in our routine practice.
So youngsters, because they don't want to quit only, they are not coming
Yes.
forward to quit. And second phase, some of the people, those who become like, okay, proactive and thinking that, okay, they have to save their life for their loved ones, they are coming to you to
They will be having slight problem to have been started.
a fear of
Yes, they will have some health issues. They will be falling sick. They will have newly diagnosed hypertension.
Hmm.
So because of that, then they will start. So at young age, I'm having health issues. Cause is this. So I have to remove the risk factor or stop that.
So you're kind of changing their lifestyle by stopping
Yes.
smoking, and then so that they can live their healthier life. And for cancer patients, still there is a motivation so that they can their cancer treatment can become faster and chance of reducing the second cancer.
Yes.
Sure. And I've seen the fact saying that okay, many people say like those who want to sing or get into the singing industry, music industry, they say because of smoking their voice can become deep and like little heavy so that they can sing better, they can talk better. Is there any correlation between voice and smoking?
So people start associating with something to smoke. People just want some reason to smoke.
Okay.
That's what the reason might be.
Okay.
In parties they want मेरा दोस्त आ गया बहुत सालों से चलो I am एक पी लेता हूँ. My friend has come. Some people passing nearby to the some pawn shop, their cigarettes are there, seeing that okay, I will have. Oh, I have to have a tea. I will have. So they start associating with something
Just
to take a
trigger.
cigarette. Yes, those are the triggers and associations which are very very important in the treatment aspect. We'll cover as the in further questions.
Sure. So, and what is the combination of this tea and cigarette? We see, okay, a lot of there are chai shops where tea and sutta. Now there is a sutta bar also which has come up. Like, there are many such things. This combination is sold as a very fashionable package.
So that is the business tactics I feel.
Okay.
As you told, Sutta Bazaar has come. So it looks like a more of good business tactic. They are selling tea. The cost of cigarette is more than the tea, and they earn more. So that is how it is. And the tobacco industry is very large, and they have a lot of revenue from it. So that's how it goes, and they associate with it, and that is the most famous combination of association of
And
cigarette
widely
with tea.
socially acceptable combination
Yes,
also.
and that's one. And second thing also, morning when they get up,
Right.
early morning also, before they have to use the washroom, that time also they associate without cigarette I cannot go to washroom.
There's any combination between constipation and smoking?
There is no association, but smoking increases the motility of your bowel or
Okay,
the
bowel movement.
gastrointestinal tract.
Okay.
So they will get addicted to it, and if they don't smoke, they tell I get constipation. I don't be
Okay.
able to go to bathroom. So that is not the reality. There are other medications and other things which help improve the constipation. Like
They are choosing the wrong path for the
Yes.
treatment of their own constipation.
that is basically I feel they are very much highly addictive to the smoking. So we do some scoring system. So in that, if early morning, once the person gets up, if he smokes within 30 minutes, then it is a very very high level of addiction, and that during treatment part they are most likely to relapse and very difficult to help them quit.
Okay.
So that 30 minutes less than, that's the time we get up and get fresh, go for washroom. So they become used to it.
So somebody who's smoking early in the morning is a pakka smoker,
Yes.
chain smoker, or they need at least 10 to 15 cigarettes in a day. That is the first sign. Okay. And what is the combination of alcohol and cigarette?
Okay. So only combination I can think of is it's a multiplier effect
Okay.
on cancer risk.
Okay.
So if you are smoking and you are not having alcohol, if you are smoking and having alcohol, if without alcohol the risk is X, it can cause 3 or 5x with alcohol.
I thought we will get extra kick if we have cigarette with the alcohol.
So extra 5 times X risk of cancer also is coming up.
Extra kick and extra cancer. Okay. Bonus. Right. And I have seen some people for even for multiple X to increase the kick and the say risk of cancer, they put the cigarette butt in the glass of alcohol.
They put the cigarette butt and they put the ash also,
Right.
the tar and all.
Right.
So you are smoking and you are drinking also, going both. There are two pipes. One is the foot pipe, wind pipe, taking into both and enjoying the both.
And I think that how many times the risk is more than.
Risk, I am not sure about the risk. What is the risk of cancer and all? Those are all definitely not good things to have. Always you should.
But it multiplies to many times.
Yeah. So those are all the carcinogens, tar, and nicotine. Those are again going into your body. You are having both smokeless and smoking form of tobacco in that.
Mhm.
Smoking, and this is your chewing or swallowing in your GI tract.
All the wrong combination together.
Yes.
There are people who I meet, okay, because I'm also a part of healthcare professional world, who say when I listen to from a doctors like you and say that okay, smoking is bad. So I hear saying that okay, my grandfather, uncles are smoking for years together, they are doing fine. What will happen to me? Our genes are very strong. So is there any connection between strong gene system or hereditary system that nothing happened to their ancestors, so nothing will happen to them? Because of smoke.
There is nothing like that hereditary in smoking. Hereditary, we have hereditary asthma, allergy, such kind of diseases. Being guarded or safe against some cigarette or something like that is not there. Okay, so only thing, yes, they might have lived. I can give like that examples many. There are people who drive like a crazy. They are surviving. The people, they drive like crazy once time and they have went to hell. So there are many such examples if we have to give just to talk. So that is not the case. What we can talk is, or what we have a scientific evidence, data. 90% of cancers are caused by smoking.
Okay.
So that we cannot neglect or cannot overlook at that. So that he might be getting delayed or he might be not be getting. So, but those who are smoker, definitely the risk is more.
90%.
90% of the cancers are smokers. So if you don't smoke, that risk is gone.
You are only into 10% criteria. Or maybe you can again by following healthy lifestyle, you can even reduce the risk further.
It's not about getting cancer or not. How good the quality of life is.
Right.
How energetic they are. How well they are. Living 90 years, 100 years is good. But with support of others on bed, that is not. Yesterday I had a patient at my clinic, 90 years. Came by walking himself. Okay. So that's this example I gave.
Right. And there are people about 45, they cannot
So we
walk
have to
even.
do a study and see. They tell, no, those who are surviving smokers, what other things they are having compared to the non-smoker. Then we'll have a better idea to tell they are strong or that
Are
is
they
not
just
the thing.
surviving or lying in the bed for 90 years? Like even their grandparents are 90-year-old and they're lying in the bed, then what is the use of that survival?
Yes.
I spoke to a lot of smokers, okay, before this podcast. Since you asked me to do a little bit of research on the real smokers, so on the tea shop and the pan shop, so I asked them, okay, if at all you meet a specialist who knows a lot about smoking, a doctor, what you will ask them? So the usual answer what I got from them was, I know that okay, smoking is harmful, but still I smoke. I don't have any question to ask from a doctor. So these people fall in which category?
So as I told before, like three categories. One are the youngsters. They don't have problem. They will be knowing, but they
Right.
would have not experienced. Once they start experience, that will be around 40, 45 years, that age. So they will come themselves to seek help for quitting
Okay.
if they are not able to quit by themselves. That is the time. Because as they say, experience is the best teacher. They will not understand once they experience it. Everyone will be knowing. Even we know many things, but it's overlooked or neglected unless until it causes some or the one or the other problems to you.
It should impact day to day life. Then only people get into realizing.
For example, during COVID times, it changed the whole world.
Right.
People at one point of time they were telling, "Kya hai life mein? Everyone is dying without anything."
Right.
So again, that notion has changed. So once you experience that death kind of fear, they told everyone is dying like that, so nothing to be done. So that is how it is. Once you are experiencing firsthand, then only you will come to know what is happening.
Right.
Then you will seek help for that matter. It can be anything. And smoking is exactly behaves the same.
So it's that they have not got any pain so far because of smoking.
Yeah.
That is why they are saying that okay, I know everything about smoking, still I'm smoking. I don't have any question. Once they get pain in their life, they will come to you.
What happens is once they are moved of 25, 30, they start getting married. They will have kids. They will have a family. They have a responsibility. So all those many factors come into play, which either force by their family or by themselves to make a better choice of quitting.
But I've heard that there is a connection between the sexual performance, libido, and smoking.
Yes, so I missed that point. So during I told from head to toe, so fertility issues are there in
Right.
male, the libido and other things are decreased in male, and in female the infertility rates are high, and even if they get pregnant, the side effects on the newborn will be more like low birth weight, premature births, stillbirths, abnormal anomalies in the baby. So these are the problems related to the reproductive system.
A lot of infertility couples we are seeing these days who are seeking out of help. What do you think? These are mainly because of the first hand smoking, second hand smoking, or third hand smoking?
It will be first hand and second hand smoking.
Okay.
If it is due to if they are rule out other causes of infertility, there are
Hmm.
many other causes of infertility.
Okay.
This is one of the cause. So if they rule out other causes, then this can be a possibility.
So smoking is also one of the major cause of infertility.
Yeah. If they rule out the other causes, there are many other causes, major
Right.
causes from gynecological point of view. If they have been evaluated and ruled out, then this comes.
Sir, I would like to ask few myths and facts about e-cigarette.
Okay.
So first is e-cigarette is less harmful and the smoking is more harmful. Is there any?
So if it was so, e-cigarettes were better and the alternative to cigarettes healthy, it would have not been banned by government of India. In
Okay.
2019, government of India has banned the sale and purchase and usage of e-cigarettes
Okay.
because which indicates it is not healthy. It is as harmful as the conventional cigarettes.
Okay. So the decision must be taken after discussing with a lot of doctors like you.
Yes, lot of authorities involved, and it has caused ill effects.
E-cigarettes are better because it evaporates only the water vapor and not the smoke, real smoke.
No, e-cigarettes contain nicotine, and some cancer causing agents also it is known to cause. And the liquid, some of the components it has are known to cause something known as lung disease, that is E. valley, electronic cigarette, and vaping associated lung injury. It's
Okay.
known as E. valley. So, which causes the lung opacity, is pneumonia kind of thing. To just tell in a normal terms, it's a pneumonia of the lungs caused by that. And it will be in a very severe form, patient seeking emergency help.
Okay. Second hand smoking of e-cigarette is safer than the normal cigarettes.
No, so it is as same as the conventional cigarettes. It has same harmful effects. It is not safer either.
But for this also there is a third hand smoking criteria because there are no ashes coming
There are
out
no
of
ashes coming out of it, so I don't think it has a third hand smoke.
it. Okay. But second hand criteria are still the same.
Yes, yes.
And people generally switch during pregnancy to e-cigarette rather than the usual cigarette. So during pregnancy, is it safe?
No. So because some women are smokers and they are planning pregnancy, but their addiction is at a high level, so they cannot avoid it. They choose the alternative, which has become a very famous in today's younger generation, that has the ill effects and harmful effects on baby.
Okay.
As mentioned earlier, it can have birth problems, low birth weight, premature births.
Now we'll go to the hookah myths and facts. Hookah smoke is filtered through water vapor again, and it is safer than the normal cigarette.
So that doesn't mean it will wash nicely like vegetables we wash and have it. So the carcinogens are still inhaled into your lungs.
Okay.
One is the tar and smoke. The hookah also has tar, smoke, nicotine, and cancer causing agents, carcinogens. So it also has those things, so it is not safe either.
Hookah is not addictive as cigarette. This is what is the belief.
Okay, so they don't do it oftenly because of the atmosphere or the kind of thing it is usually used. Well, unlike cigarettes, it is used routine basis wherever we go. But the fact is, you can get addicted even if you smoke less hookah. It is more harmful, say some 50 to 100 times than the cigarette.
Okay. So one hookah is equivalent to say 100 cigarettes.
Yeah, so the amount of gases you inhale, the carbon monoxide and other things, it is 0.5 liters in one cigarette.
Okay.
It is 50 liters in one hookah.
So that is almost 100 times.
But the reason is because they will be smoking for a longer duration, say 1 hour, half an hour, or they will be taking deep inhalations, lot of deep inhalations. The quantity and duration is more. That is the reason.
Okay. The last myth is hookah is healthier than the cigarette.
That question has been already cleared. The
Right.
reality is different. It has nicotine, cancer causing agents, and the smoke or carbon monoxide which goes inside is way higher,
Right.
which is the main problem, main factor for causing the COPD, which causes the drop in oxygen levels. Circulation is delayed because it causes the narrowing of the blood vessels in the body.
Okay, if somebody wants to quit smoking or get rid of tobacco, what are the steps they should be taking?
So there are multiple ways of quitting smoking. One is the person quits himself by his own will. That is famously known as cold turkey, going cold turkey. Suddenly he stops by himself. The other is they seek help of medical professional. In medical professional, there are many specialities who are involved in smoking cessation because it causes ill effects on all organs. So all specialists can be pulmonologist, can be cardiologist, who patient went for heart attack. So cardiologist can counsel that patient to smoke smoking and initiate smoking cessation or refer to a trained specialist, psychiatrist, psychologist. So these are the mainly oncologist. They see a lot of cancer patients.
Right.
So oncologists. So these are the specialists who mainly deal with the smoking patients. So they have the opportunity and they can keep reminding or keep giving advice, whatever reason they might come for other health conditions. Give them this advice of quitting smoking, and if they need any help, just give them the support or refer to a proper specialist who is trained in smoking cessation.
Okay. This tablets of nicotine is also can be used in the smoking cessation.
So smoking cessation, it is a very structured treatment. So just let me tell, one person quits by himself, relapsing back is the chances are higher
Okay.
because he is not monitored and it is not controlled by anyone. He himself controls, depends on the person. There are very few, less number percentage of individuals who have achieved this success of not going back, quitting altogether. And most of them, 95% of them, they might require help. In that, there are different modalities. One is pharmacological, another is non-pharmacological. Pharmacological matlab will give tablets or medicines, medications. Non-pharmacological, behavioral counseling. It mainly the psychologist and psychiatrist they do it, and psychiatrists from traditionally they are treating these addictions, alcohol, the addiction might be smoking, but for one or the other reason, I don't know, but it has not been in a broad scale because it's not concentrated like advising till the problem arises. It has not been addressed. Issue has not been addressed. In that medicinal treatment, nicotine replacement comes. Their nicotine, it's we give the same nicotine. So the question is, the people will ask
Yeah.
whether it is same thing, how different you are doing, but it is controlled nicotine therapy. It's under supervision of a trained medical professional, not however they want uncontrolled, and it doesn't have other tar, carbon monoxide and other cancer causing agents in that. It has only the nicotine, which is the most addictive and pleasurable element, so that is used.
So you take out all the harmful part from the cigarette and you give as a maintenance dose for some time so they don't have withdrawal symptoms.
It's a dose calculated based on the patient's need of cigarettes.
Mhm.
As I mentioned you earlier, less than 30 minutes in the early morning if a patient takes, then the dosage differs. If the patient takes less than 20 cigarettes per day, the dosage is different for the patient who takes more than 30 or 40.
Okay. So somebody who's taking cigarette in the first 30 minutes is considered as what? Can we calculate then how many cigarettes he must be taking in a day?
Roughly more than 20.
More than 20. So that is the first sign.
Yeah.
If you see
So
someone who-
them, they even if they are not taking like say just 15-20, the dosage of the nicotine replacement differs.
Okay. But that is the first sign. If first half an hour, if somebody is
Yes.
smoking, that means they really in need of nicotine and they need
That
it.
is a key
Another
indicator.
key indicator. Okay. Great. And if someone, let's say, which criteria of patient, what is their mindset when they come to stop smoking? Like, what is their mindset?
So one is they want to quit because of some problems. Second is because of the family pressure. Their loved ones want them to be healthy and all. So they come by the pressure of the loved ones. So these category of patients come. So that is the mindset. They come with a mindset. When they come to the doctor, their half job is done because they are willing to quit.
So ultimately, it is on the person and somebody who's smoking, he has to start thinking that he has to stop
Yes.
because he initiated smoking. He himself have to decide that he wants to stop,
Yes.
unless nobody can help.
So, for example, I have two category of patients also. One category they have come themselves because they started having problem like low energy levels. That is very important. Low energy levels which we see. Second, it hampers with their performance in whatever they work. Second is the loved ones. So I have a patient of asthma. His father he got it for cessation to me. So he was taking treatment for asthma, the son. So he got his father. He used to hide all the tobacco sachets in all corners of home, so that wherever he gets chance, he can take. So that is the level of addictions people have.
Okay. So at least some family member of this. So somebody who has been brought by family member and somebody who has come by themselves. What is the improvement?
So those who have come by
Ratio.
themselves, it is very easy to convince, and the treatment part is very smooth.
Okay.
Those who come with the force of their family members, once they start realizing they are better, feeling better, they might also cooperate in and quit.
But the cooperation is difficult.
Cooperation is little difficult.
Maybe first few sessions are most
Yes.
difficult. We've discussed so far that what ill effects of smoking, what can happen. People can quit also, and with the help of doctors like you, you can help them quit and get back to a normal life. But what happens immediately after smoking? Like, what are the withdrawal symptoms, or what effects a person can see on their body and mind?
So there are a lot of benefits quitting. Within minutes, the benefits reflect.
Okay.
From minutes to years, the benefits are. Immediately, say in 20 minutes, the heart rate drops, the BP drops. Okay. Then after 24 hours, the nicotine level drops to zero in the body. And after 2 to 3 days in between, sense of smell and taste is better than a non-smoker. The energy levels are better in 72 hours. Then once you go beyond that, say several days or a week, the carbon monoxide level in the body decreases to the level of a non-smoker. After that, 1 month to 1 year, 1 month to 12 months duration, the cough, breathing difficulty in COPD patients decreases. The oxygen levels improve because the carbon monoxide levels are reduced. It helps in better oxygenation levels. Then in 2 years, the risk of heart attack decreases. In 3 years, other cardiac coronary heart disease risk also reduces significantly. From 5 years to 15 years, the various cancer risk, head and neck cancer, food pipe cancer, lung cancer, the risk reduces to half. In 15 years, at the end of 15 years, they say the risk of heart disease reduces to that of a non-smoker.
Okay.
And after 20 years, the cancer risks becomes similar to that of a non-smoker. So these are the multiple advantages. Along with that, the quality of life is better.
Wow. That means from a minute someone stops smoking, they can start counting on the benefits.
Yes.
Okay. Finally, what are top 5 points you want to give out to the smokers?
First thing is tobacco, whether in smokeless or smoke, both are dangerous, equally dangerous. Never fall into the prey. Don't touch it first.
Okay.
That is the first point. Never get into that habit. And it is not a habit, it's a disease by itself.
Okay.
So it has to be treated like any other disease. If you have any disease, so it has treated by specific treatment. In the same way, this has to be treated and removed, uprooted from the society. And alternative forms of smoking are equally dangerous to conventional tobacco cigarettes which they have. So those has to be avoided. Not shifting from one to another goalpost and having the same problems. Both are equally dangerous. And if you are willing to quit, seek a medical professional help. So the chances of relapse are less.
Correct.
And we have a World No Tobacco body, that's the WHO. It was started, World No Tobacco Day is being celebrated. It was declared by the World Health Organization from 1987. So every year, 31st of May, this day is celebrated to create awareness to make a society tobacco free. So this 2024 theme is protecting children from tobacco industry, because as many young adults, youngsters are falling prey to the e-cigarettes and conventional cigarettes, switching to the e-cigarettes. It has become a fashion. So
Right.
to create that awareness among the children, the theme has been designed accordingly.
So from young age only, they have been educated about.
Yes, so we should have a education in schools and all, because we see lot of schools and all children. So we should not hesitate to talk. It has to be the information has to be passed on about it in the young adult minds. And
But there is a
young
fear
children.
criteria that if we talk to children about cigarette, they will start smoking.
No, now in this technological world, they are already aware of most of the things. Even we people will not be knowing such things; they will be knowing. So I don't think that should be a hindrance.
So we should not hold ourselves back talking about smoking to our children.
So these are the 5 things I will list and say.
Sure. So any closing note you want to give? What government initiatives are there for people to stop smoking?
Government is very proactive. They have increased the size of the cancer sim
Photo
pictures on the tobacco products,
right.
whether it might be a covering smokeless or smoking form cigarettes. Everywhere it has been there, and every movie you go, you see the ad of it
Yeah.
regarding the tobacco ill effects, and you have to quit it. There is one government helpline also to call to seek any help. So there are a lot of initiatives taken by government in that right direction. They have banned e-cigarettes in India. That is,
I think hookah is also banned now.
hookah is banned in government of Karnataka recently. The sale and usage has been banned altogether by government of Karnataka recently.
Thank you for joining us for the podcast. And for viewers, those are smokers, please follow Dr. Mallikarjun sir points. And those are non-smoker, just watch it and feel lucky that you have not fallen prey to the smoking and you are not addicted and you are not diseased. You are a healthy adult. Thank you for watching.